You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alavrez. Today's topic, we're talking about wellness today, and one of the newest centers in the desert. Very impressed with this, by the way. And with us, we have the founder, well-known doctor in the desert, Dr. David Sachs. Dr. Sachs, welcome to the program.
Hey, Randy. Nice to see you again.
Now, before we get into today's topic, your new center, and this is brand new, it's called Sachs Wellness. And I think you're about the only place in the desert that's like this. Very unique.
That's true.
Tell me about that.
We opened about May 1st, and we have a very nice large team there, about 34, 37 people. And we offer physical examinations, laboratory profiles, and we see not only traditional patients, but we see patients who are looking for wellness.
So you do like longevity and anti-aging medicine, some may call it.
Yes.
Is that right?
That's correct.
Bioidentical hormone replacement?
Yes.
You have a weight loss program?
Yes, we do.
All right. Now, I asked you in the green room, I said, in a perfect world, we air this television show in the desert. I said, who do you want to attract? I mean, who's your ideal patient?
I think the best patient would be a person who wants to become well. They want to possibly lose weight. They want to feel better. They want to think clearer. They want to move and exercise, and they don't want to take a whole bunch of pills. A lot of doctors, each doctor that you see tends to give you 3 or 4 meds, and by the time you turn around and you see 6 doctors at 4 or 5 pills each, you're taking 20-some pills.
Is that realistic, though? I mean, are there patients that go to you with 20 pills? Or
yeah, they bring in a little brown bag,
really?
And they show me that this is what they take. And I never tell anybody to stop their medication, but I do tell them after an extensive physical and laboratory profile that they may not need certain medication.
Do people, I mean, okay, let's say your best patients. Have you had people wean off these
sure.
meds?
We've had diabetics who are taking 2, 3 pills and maybe insulin shots. We've had hypertensive patients taking 3, 4 pills to control their blood pressure. We have people who take
that have been reversed, weaned off of these things?
That have been reversed and or weaned off, along with a little weight loss and feeling better and exercising and fueling the body right. A lot of good things happen inside the body. The immune system changes, the confusion lessens, the integrity of the whole system coalesces.
I know your pricing.
Yes.
I mean, it's very low.
It's not high.
We can even probably say it on the show.
Sure,
I mean, to have you as a doctor or your team,
yes,
these 30 people that you have access to, it's about how much?
$495
to start.
To start.
And then
they pay like a gym membership, $150 per month.
But moving over to some of the disease states that you see.
Yes.
Like diabetes.
Yes.
A lot of people pre-diabetic, diabetes that come in.
A lot of people have diabetes. Their hemoglobin A1Cs are very high, and they think they're under full control, and we just tell them, no, you aren't. And your pills, the metformin and the Actos and the Januvia, even insulin, isn't correcting it.
So what's the answer?
The answer is to fuel your body with fruits, vegetables, lentils, beans, plant protein, and to have a little wine and loosen up.
So here you are, you're the doctor.
And move and exercise.
And you're telling them, though, to have a little bit of wine?
Yes.
In moderation?
I even tell them where to go to buy the wine, to Jensen's food store.
So what do they say when they hear this?
I tell patients,
I mean, what do they say?
When they ask me if they need a hospice company or they need a nursing home or they need a specialist, I give them always minimum 3 names. I have 3 cardiologists that I will refer them to, 3 hospice companies, 3 endocrinologists, 3 of everything. Because
you're like the quarterback, so to speak, in their healthcare?
Yeah, and they need to see specialists besides me. I'm just a family doctor who has a wellness center and still makes house calls.
Is that so? You still see patients in their house?
I still see patients in their home. I still go to nursing homes, and I medically direct 2 or 3 nursing homes.
You like that?
I like being busy. I'm a workaholic.
Now, you have this wellness center. What's your biggest satisfaction?
I get my greatest satisfaction seeing patients who sometimes shuffle in, who weigh 300 and 400 pounds, who can't even walk properly, who can only shuffle in and sit down in a very large chair and chat with me that they want some help, that they're a class 3 or 4 cardiac patient.
All right.
They can't breathe, they can't move, They can't enjoy life. And I tell them that if they think that wellness, a new diet, an exercise program where we feed it to you and help you, because if I have a marvelous, great big team, and if this team needs to give them physical therapy, occupational therapy, exercise physiologist, yoga, Tai Chi.
It's all there.
It's Reiki nurse. It's all there.
Now, I interrupted you, though. When you were saying, I said your greatest satisfaction, you were talking about the cardiac patient, the overweight patient.
Yes.
It's the reversal of their attitude, the reversal of their problems.
I think the greatest satisfaction is when I weighed almost 300 pounds and I started to eat plant protein, and I was taking 3 hypertensive medications and 3 diabetic medications plus insulin, and thinking I was doing well, and came down with some abnormalities and woke up and started to do the right thing. And it took me maybe a year, 18 months, but I turned things around. I'm medication free. I take vitamins.
Good for you.
And supplements.
Medication free.
Medication free.
At your age.
At my age, 70 years old.
So it's possible for anybody then.
It's possible for most patients to get help and do well.
People say Dr. Sachs is the desert's wellness doctor.
Yes.
How do they hear about you now?
They hear about us now through mainly advertising.
Okay.
I go on shows
Like Desert
yours,
Sun?
Desert Sun, internet.
There's other shows like mine?
Internet,
Okay.
Papers, billboards. But we have a lot of fun doing it. And the whole team helps us do it. I don't do it myself. They come out and film the whole office.
Is that right?
Yeah, and they all have something to say. And we do all these things for free for people who just want to see what we do. They get free facials. They get free massages.
What does that mean by this free? I'm confused at this.
Well, some people want to see what the office looks like.
Just see what they're doing.
Yeah, and
See
they
what
want
you're
to see
doing
what they do. So our esthetician will give them a facial, or our chiropractor will give them a treatment and line them up better, or our naturopath or a homeopath will do so and so. And we have speakers who come in. They can come to
Really?
our office and they can listen to doctors and clinical psychologists and psychiatrists talk about wellness.
Is this your dream practice?
It's a dream practice. It was either buying a Rolls Royce and retiring and driving to some restaurant in this absurd car, or spending a lot of money, which I've had a lot of fun doing, and opening up Sachs Wellness Center.
What do you want to be known for at this center, by the way? And what do you want the patients? And there's a lot of sick people.
Yeah.
There's a lot of healthy people in the desert.
Right.
But there's a lot of people that aren't living at this optimum health.
Correct.
So what do you want them to know about your
I
center?
want them to know that if they call in or stop by, that we are willing to answer questions for them. We are willing to give them a trial. We are willing to ask them to sign on and to do any program that we offer in order to get well. Getting well takes a lot of life changes, 360-degree changes.
Do you have patients that feel like, because of your help and your team, that you've changed their life or given them their life back or any of those things?
Yeah, because when you sit with your primary care doctor, they tell you things that they maybe only tell their priest or tell their rabbi or tell their minister. They tell me things like...
The patients tell you.
Yeah, patients will tell me, I think I'm moving out of state. I don't like my job. I think I'm going to get divorced. I'm going to kill my sister. I'm going to kill my brother. I mean, they tell me all kinds of things, but I expect them to tell me. Because once you win their confidence, they're in the program. If they don't like me, how could they join a program?
So part of your thing is to put their life in perspective in a positive way?
Yes, and I don't do it by myself. I have clinical psychologists, psychiatrists, many other doctors, and life coaches.
You mentioned something earlier about people becoming more social. There's a lot of people in the desert. Maybe they used to go to the charity events or the functions or the McCown, and they stopped.
That's right. They stop because they're aging and they're a little bit more confused and they're a little less active and they're a little bit more not intrigued with life forces.
And they could get that back.
And they
though?
get depressed and they get blue and they get sad and they sit at home and they start to hibernate.
They could get that back.
Well, the human body's not made to hibernate. You got to keep moving. You have to move, move, move. I don't care if they walk, shuffle, swim, go bowling, or walk from store to store, or go to our mall, because, you know, when it's 110 or 112 or 118, you walk inside air-conditioned places. But if you live in the desert, our summers are very hot and dry, and our winters are beautiful and balmy and 70 and 80 degrees, and cool nights. You can wear a fur at night.
So you get them moving again.
Yes, we get them moving again.
I mean, people that weren't out and about are now out and about.
And don't forget, I do traditional medicine, and I do wellness. If they need a combination of both, I do both.
Let's talk about bioidentical hormones.
Bioidentical
You're a fan
hormones.
of bioidentical
Yes, I am.
hormones. Okay. Typical patient, let's focus on women for a moment.
Okay.
45, 50 years old.
Premenopausal, postmenopausal,
and men
at 25 and 35 lose libido, lose sex drive, are very unhappy with themselves.
Okay.
And we tell them, after proving their laboratory work from cortisol level, immune system, insulin, thyroid, T3, T4, T7, TSH, we treat the whole gamut, along with testosterone, progesterone, and, you know, estradiol.
Let's start with testosterone.
Testosterone.
Okay. 50 plus person comes to you, male and female. What?
They tell me that they have a very poor sex life.
Okay.
They have very poor sex drive. And they tell me they have seen other doctors, and they have tried creams, or they have tried this, or implements, or this. They've seen urologists, fertility doctor, all kinds of doctors. And I tell them that through laboratory work and taking bioidentical hormones or shots of testosterone, and if they need B12, B6, or iron, or whatever they need, according to their lab profile, we balance their system, and they feel 100% better.
Do you see people with no sex drive, and they have sex drive?
Yes.
You see people with no ambition, and now they have ambition
And we
again?
give them some testosterone shots for a few short weeks. We monitor their blood work to make sure everything's fine. We watch their PSAs. We watch everything very, very carefully.
Is it safe testosterone in your opinion?
Yeah, I'm a very conservative doctor. I listen to all main authorities. From the Cleveland Clinic to Scripps to Mayo to, I go to seminars all over the world.
Now, you know, knowing you were coming on the show, and I know you do bioidentical hormones as well, testosterone, a lot of negativity, but some positive stuff.
Yes.
Is it true, or are you of the same belief, I should say, that low levels of testosterone can increase your chances of prostate cancer?
That's true.
Could you elaborate on that?
That's very true. They have done many studies, and men who get in the 4th, 5th, 6th, 7th, and 8th decade of life who have low levels of testosterone end up with more, you know, prostate cancer.
Okay.
So we take note of anything high or low. If that is cholesterol, triglycerides, HDL, LDL, VLDL, what your B12 level is, what your folate is, what your T3, T4, T7, and TSH is, because it all works together.
Okay. Now, do you have, okay, so we're talking about bioidentical hormones, we're talking about Sachs Wellness Center, the Desert's Wellness Doctor.
We also use progesterone, and that has a very calming effect on many women and men. And they just put a little bit of progesterone cream on their arm, and they rub it in.
Made by a compounding pharmacist?
Made by a compounding pharmacist. And I don't care what pharmacy they go to. I don't care if they want this one on Washington Street, or this one in Palm Desert, or one in Palm Springs, or whatever the pharmacy is. Just like the specialist, I give you 3, 4 names. You tell me, and I call the pharmacist, he compounds the drugs.
Okay.
Because
so you'll work with whoever they're using now.
Well, not only that, they are refillable.
Okay.
And people want to get refills for 3, 6, 9, 12 months. Everybody just want to come back and see us right away. So we want to make these assessments and these memberships clear so they're fine for the whole year. Also, they may call me up and say, I have a cold, or I need so-and-so, or my husband stepped on a nail. And so we do family practice too. I have a great team. I have 3, 4 very specialized nurses who are boarded in. My head RN is a lawyer.
Okay.
My nurse practitioner does wound care. My cardiology nurse does family practice. My pulmonary male nurse does also family practice and hospice work. They all have been around a very long time, and I've trained most of them in my other projects when I worked for other, medical groups.
Okay. Now,
in fact, I drove them crazy about working for me, and I started 10 and 12 years ago. And they said, yeah, you're going to do this.
Now, is this true about your center? And it's hard to believe that you say you don't even like the staff. I'm talking about at Saks Wellness.
Yes.
It's like punch a time clock.
No. I love my staff,
okay.
But I tell them, I'm not telling them what to wear to work, when to come to work, what music to play, but they must be fair and customize their service to every patient. Our girls in the front must talk to the patient. Our phlebotomists must treat the patient right.
But they could come and go as they want.
They can come and go as they want.
Has that ever been done, by the way?
Yeah, I have a doctor to take my place. We have 2-3 phlebotomists. We have 2-3 nurses.
But why this practice philosophy?
Because I believe...
Is this part of a wellness thing?
Yeah, and seeing patients at nursing home and seeing how they hire nurses there and how they run HMOs and how they run other geriatric practices such as wellness and palliative care, and even at the prison system, you need very diversified people who can carry their own weight and do their own thing. I don't want to hold hands and tell somebody, but if a patient tells me so-and-so wasn't fair to them or nice to them on the phone or in person, or their body language wasn't good, I correct that very gently and quietly.
Okay, and we are closing out on time here, but we should mention for people tuning in, we're talking about the hottest wellness center in the desert. Very unique, by the way. And people that come on my show, I try not to endorse them, but you have a very unique wellness center. You've got weight loss programs, you've got chiropractic, acupuncture, stress reduction, nutrition, cooking classes. You tell them to drink a little bit of wine. You teach them how to be more social. Right. Is that right?
That's right. Because
I don't know if I left
that.
anything out. Exercise physiologists, personal trainers,
but Reiki nurses, Tai Chi, everything. You have to have it all because different people need different relaxation techniques.
Your background, I wanted
to
bring up that people need to know you've been working with the aging population
for a long time.
With manner care. You've dealt with aging people on 10, 20 medications. That's your expertise.
That's right.
And you're board certified in family medicine.
That's right. Okay. And in risk management.
Okay.
And in old age. I'm old.
So by working with these seniors for so many years, does it make you better to take care of, you think, the aging population of the 50, 60, 70, which is very young in the desert?
No, I think what we have to do is, I think you have to listen. Most doctors don't listen. They're either writing on their laptop or they're taking notes or they're not looking at the patient. They're not listening to the patient. When they're with me for a whole hour, I just listen to the patient. When the patient leaves, I have a little microphone that I pick up and I dictate into this dragon very, very nicely, and it does the whole chart. Every person who works in my office has access to that chart. Nutritional counselors, RNs, phlebotomists. So whenever anybody comes in or calls, the chart is opened up and marked appropriately. If you just come in to get a B12 shot, they weigh you and take your vital signs and give you a B12 shot. If that's all you're there for, hello, Randy. Goodbye, Randy.
Okay, good. Okay, so bioidentical hormones we've talked about.
Bioidentical hormones.
You have a weight loss program there.
Weight loss program.
Tell me about the weight loss program.
Our main weight loss program is eating the right food, fueling the body correctly. And that's with plant protein, vegetables, fruits, lentils, beans, pasta, and some wine.
All right.
Yeah, but patients sometimes want quick weight loss programs. So we offer HCG and many other programs.
HCG weight loss.
We have a registered dietitian. We have a nutritional counselors, and they handle the other weight loss programs with the patient, because everybody doesn't do well on just one thing.
So you have, by the way, your patients, okay? They're just the regular folks, but also you have a celebrity following.
I have.
Is that right?
Yes, I do.
Literally the biggest name celebrities.
Yes, I do.
In the desert are some of your patients.
Yes, that's right. And they're very nice, and they're very sweet, and they're very knowledgeable. and they go and buy programs that are reasonable and that prove well to them, just like choosing the right stocks and cars and homes and everything else.
So the doctor, celebrities will watch this show, or just the regular housewife. If somebody says, I like that guy and I want him to be my doctor, right?
Right.
They can do that.
Yeah, they can just call us. They can call 760-779-9100. Somebody will pick them up, bring them in, or chat with them over the phone.
Somebody will pick them up?
Pick up the phone call.
Oh, I see.
Pick up the phone call.
Okay.
And our phones are answered 24/7, and we're there from 9 till 5, Monday through Friday. We don't work holidays. We don't work any holidays.
So you relax on those holidays?
I relax on holidays, and I usually go to nursing homes and do other things.
Okay, now stress reduction, nutrition, fitness coaching, skin care. I mean, this is a big topic.
Yes.
Obviously. But
Yes.
it is wellness, because wellness is loosely used.
What we do is we purchase the best products that we can.
Okay.
We purchase the best vitamins, the best minerals, the best B12, the best testosterone.
In your opinion.
In my opinion. And we buy the finest nutraceuticals, cosmetics, and our estheticians help these patients with makeup and their skin. Because in the desert, we have a lot of sun.
Yeah.
And people have a lot of burnt skin and skin problems. And as you get older, you get a lot of little skin
But
problems.
is that your place as a wellness doctor, to be worried about their skin?
Oh, yeah,
as well?
I think so. We just have a special doctor who just does Botox.
Okay.
That's all he does is inject Botox because people want to get rid of their wrinkles.
All right, so you're okay with Botox?
I'm
then,
okay.
as a wellness doctor?
Yeah, I'm okay with that. I'm okay with vitamins. I'm okay with minerals. I'm even okay with people saying, I need more or I want something else, and we offer them other programs.
So when a patient comes to you, okay, so they're in their 50s, 60s, 70s. They're not feeling good.
Yes.
They've heard a little bit about bioidentical hormones.
Right.
They've heard about HCG weight loss. Or,
Right.
or maybe they know that, maybe I need to, get off 5 of my meds.
Right.
Is that the kind of patient you'd
Yeah,
like to see?
we see those
to
kind of
convert
patients.
to this more
really,
wellness?
It isn't what I want to see. It's what patients I can possibly help. Some people are very timid and shy and quiet, and they say, oh, doctor, I'm here, everything's fine. I know immediately everything's not fine, otherwise they wouldn't be sitting in front of me.
Did they say that?
Yeah, and when I get to know them and review 3-4 pages of lab work and explain what their lipid and cholesterol is, what their blood count is, what their anemic pattern may be, what their cortisol level, what their thyroid tests show, what all these systems show, and mark it down for them and give them a copy to carry home. Every time they come back to the office, we bring up those same sheets, and every visit we get their vital signs, temperature, whatever we have to do to keep an ongoing proper chart.
You have the luxury of time.
Yes.
You spend more time with patients.
Yes.
That's your
what
competitive
a
edge.
boutique practice is.
Okay.
That's what a boutique practice is.
So boutique practice, that's what you consider this.
That's right.
Okay. And other doctors
Yes.
will watch my show.
Yes.
They don't like to admit it, but they
Yes.
watch my show.
Right.
And what do you want them to know about you?
Oh, most of them
The
know me.
cardiologist,
Yeah,
the-
I mean, I have been
okay.
there many, many years.
All right.
Yeah. I came out to the desert back in 83, 84.
All
So
right.
I've been
Oh, wow.
there many years. I refer to most of the doctors, and I respect them, and we write for even personal injury cases.
But what do you
and
want them to know
attorneys.
about your wellness center?
I want them to know that we have a very thorough wellness center, that down the road we're even in a few years going to have a retreat house so that patients
Great.
can come there and spend 3-4 days and get the same massage and facials and manicures and pedicures and hair done and draw their blood and have physicals, and pharmacists will talk to them, compounding pharmacists.
Yeah, yeah.
And this is how it's done. It's not done with me.
Is this the future of medicine?
I think so. I think so. Yeah. I think that people want to change, and they just don't want to go see 4-6 doctors and take 18-20 pills.
So there's a lot of confusion, with, like you say, you offer nutritional supplementation,
Right.
vitamin minerals, bioidentical hormones, different weight loss programs. Do you feel like that your role is to eliminate a lot of the confusion?
I
to
hope
help
so.
to guide them through this
Yeah, because
aging
if
process?
I don't have all these people there to guide them through this, they can't do it with a single person. They just can't. They need nurses, estheticians, skincare people, physical therapists, occupational therapists, exercise physiologists, Reiki nurses. They need everything.
Really?
Even
Okay.
hypnosis. Because a lot of people are resistant to change.
Okay, interesting. Resistance to change.
Yeah, they're resistant to change, and you have to offer all these things because everybody doesn't just do well with talking to me for 30 or 60 minutes.
I do well when I'm talking.
Yes,
to
you
you.
do
You make
well.
me feel relaxed, right?
Good. I hope so. I hope I do.
What's the biggest compliment a patient gives to you that you like, that you go home and you say, that was nice?
I think that they say sometimes, you know, I'm glad we found you or met you, that you've been very special to our whole family. You've been special to my mother at the nursing home. You've been special on making house calls. You've been special to my husband. You've been special in time of needs. And
Good.
you don't want anything back.
Good for you.
Yeah, it's nice. It's very special.
We're out of time. I want to thank you so much for coming on the show. But final message.
Yes.
Somebody, they're not feeling so hot.
Yes.
Maybe they've lost hope
Yes.
of ever getting in shape.
Right.
Or having energy.
Right.
Or sex drive or whatever. What
Yes.
do you say to them?
Call the center, come in, stop in, walk through, talk to all the nice folks at the Saks Wellness Center, and if you want to try us, we will accommodate you.
All right. Thanks so much. Great stuff. Great info.
Good.
Good interview. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alavrez. If you'd like to see this again online, visit our website at wellnesshour.com. Put in Dr. Saks. We'll also have this on our YouTube channel. Put in Wellness or Dr. Saks. You'll find him there. For now, I wish you good health.